Thank you for tuning in to Sapphire Snuggles Resource on TV. We have a special guest today. This is Baby Atlas. So he's going to help us with our topic, which is talking about fever and your baby. So it's actually two parts to this, and it's talking about what's considered a fever and how do you know if your baby has a fever, and also causes a fever. So that's going to be part one, and in fever and babies. So usually we know when a baby get a fever, they're really cranky, upset, and you just don't know what's wrong. You're playing a guessing game, just trying to figure out what is going on with my child. They're hot, what do I give them, or whatever it is. We want to get to the problem. We want to fix it as soon as possible so baby can have a level of comfort as well as parents. So I know it can be alarming, but all I can tell you is to center yourself, just try to figure out the problem, and we will tackle the problem together. So the good thing about a fever is that you know that your child is fighting off some type of infection. So that's a good sign. Even though it's an uncomfortable feeling, it's a good sign that their bodies can and is able to fight off any infections that they may encounter. But it is very, very important to figure out what the fever is from and how can it be treated. And most of all, keep your baby hydrated and comfortable during this time. I always tell parents, please keep your energy in check, because if you're all over the place, your baby will never ever settle down. So just make sure that you're settled and just try to get to the place of wellness, health. That's the first and priority. So what is considered a fever? A child's normal temperature can vary depending on age and activity level. Time of the day can also affect the baby's reading. Body temperature is usually highest in the late afternoons and early evenings, for example, and the lowest usually is at night and early morning, maybe because they're not really up and running like they have, or at night they have settled down and just ready for bed, and everything, the body is just trying to wind down. Plus, infants tend to have a higher temperature than older children. So that's one thing to be mindful of as well. Just because maybe your 2-year-old have a fever this many degrees, the little one may be a little bit higher. So that can bring on alarms too, but actually that's normal. Generally considered true fevers, the readings. So you will want to get a rectal reading of 100.4 Fahrenheit and 38 degrees Celsius. That is the pretty much truest reading that you can get, is a rectal reading. Oral reading in older children, I would say toddler wise, you would try to get an oral reading under the tongue or under the arm of 99 degrees Fahrenheit and 37.2 Celsius. So I want to demonstrate how to take the baby's temperature. This is only prop, so this is not an actual thermometer, so it's just a prop. So use your imagination with this. So we know babies cannot open their mouths and stick the thermometer under their tongue. It doesn't work like that. So usually how I would take the temperature, I would go under baby's arm and take temperature, hold baby arm under here, take the temperature, hold for a few seconds, see what the proper reading. Usually thermometers will beep when it is correct. Make sure you take the clothes off a baby, have baby with skin to thermometer. That is how I do an oral. Rectal thermometer. You only stick the thermometer only about that way. Most of them have a silver tip, and you just go just as far as the silver tip. You do not have to shove it. You do not have to lubricate. You just go into the baby's rectum, very soft, very gentle. I suggest to please keep baby covered in that, because it can stimulate the baby to have a bowel movement. So I would suggest that you please keep everything covered in your area that you're working in. You keep the thermometer there until it beeps and it gives you an accurate temperature. Also, a rule of thumb, if you're going to use this as a rectal thermometer, please label it as a rectal thermometer. We do not want to put a rectal thermometer in an oral mouth or an oral part of the body. So please, please, please always remember to cover your instruments and label them as needed. Also, another temperature that you can use is like the forehead temp. Remember, this is just props. The forehead temp, you can just stick, it usually sticks on the top of the baby's head, and you don't have to hold it. It just sticks there. Sit there for the amount of time that the instructions tell you, and it'll give you a great reading. So that's how you would know your baby have a fever, if your thermometers specify at 100.4. Causes of fever in babies, I apologize for that, is usually ear infections, common colds, urinary tract infections, sinus or throat infections, intestinal bowel infections, RSV, another thing to look out for, croup, influenza, which is the flu, pneumonia. The most serious conditions that can cause fever are blood sepsis and the brain and spinal cord, which is meningitis. So you want to make sure that you can, well, not you, but the doctor can rule all of that out. Always seek your pediatrician's advice or go straight to the emergency room if your baby is under the age of 6 months. That is not something to debate. You go straight to the ER, because we never know what's going on with the newborn baby. And you want to do a checklist of everything to make sure doctors have checked everything on your baby to make sure that they are going to be in perfect health and to get to the actual root of the problem. That's all I have for you today. In part 2, we will discuss the fever in newborns, febrile convulsions, and whether or not teething causes fever. So I hope you tune in. Baby Atlas may make another appearance, so I hope we can go ahead on and settle that. So thank you for tuning in, and like and subscribe. Bye.